delighted to welcome you to Eye Contact, a video news programme on issues and controversies in ophthalmology sponsored by EuROTIMES. I'm Paul Rosen and we're here at the 6th EuCornea Congress in Barcelona. Now, corneal collagen cross-linking, or CXL, was invented by Professor Theo Seiler in 1998. And since then, many thousands of patients with keratoconus and ectatic corneas have undergone treatment. Today, we'll be getting an update on CXL from Prof. Seiler, who is the founder of the Institute for Refractive and Ophthalmic Surgery, known as IROC, in Zurich. Theo, welcome, and I'd just like to start off by asking you, what do we know about the long-term results of CXL?
Paul, thank you for inviting me to give that nice conversation. You know that we treated our first patient now 15 years ago in Dresden in the old days, and those patients have been followed now for 15 years. In prospective studies, however, we started in Switzerland in 2005, and so at least in those prospective controlled studies, we have a 10-year experience.
Where are we up to with the, I know it's undergoing FDA approval in the US. Where are we up to with the phase 3 trials there?
You know, I'm not sure about whether this is now a scientific or ethical problem anymore. Okay. I understand that there are a lot of politics involved at the FDA. And so a procedure that is done worldwide 10,000 times per month, okay, and is not yet, doesn't get permission for USA, there's at least that postponing the decisions 3 months, quarters per month, and another quarter, that is rather questionable.
Okay. Can we just ask about the definition of success of CXL?
I mean, the success is very simple. We want to prevent progression of keratoconus. And so whenever we stop that progression, this is considered to be a success. In a fair amount, up to 30% in some series, we get a regression, so a way back, a reversion of the progression, but we never promise that, and we should not.
Okay. What would you define as progression in terms of corneal curvature change?
We do have a lot of definitions, but the most simple one is we take 3 times the measurement error of one of those measurement variables, like Kmax. If we have a stabilization within the 3 standard deviations, that would be a stabilization. And the time frame we decide whether it's stable or not should be 1 year or more.
Okay. What about the complications? What's been reported?
See, at the very beginning, everybody thought that's an easy procedure. Nothing is really difficult. Meanwhile, we know that we do have very difficult phases within that whole cross-linking procedure. The first one is you have to select very carefully which patient or which eye should get a cross-linking. If you're selecting the wrong one, you're in trouble. The second one is then the second phase, which is dangerous. Surgery itself is easy, but the second dangerous phase is the epithelial healing phase. If you don't do a good job during that, those 3 days or 4 days, again, we can make mistakes. Okay. And then it's a self-running healing phase within the first 6 months to 1 year after surgery.
Okay. What do you think about, we're talking about epithelium healing, what about epi-on treatments?
Oh, epi-on, if it would work, everybody would right away go over to the epi-on. But the last scientific news we've got from epi-on was that published study from Siena, and the Caparossi group showed that after epi-on, they had to do retreatment 2 years after the original treatment in 50% of the children. Okay. That's not fair.
No. And what about combination with other treatment modalities, for example, excimer laser surgery or intracorneal rings?
I mean, with the ring, it's just a different tool. The ring is an optical instrument just to reform the cornea or reshape the cornea in a way that it's as spherical as possible. But cross-linking doesn't do that. Cross-linking freezes the cornea in the state like it is today. So doing a shape change with a ring and at the same time a cross-linking makes sense.
Yeah.
However, and we all know that some of the rings, up to 30% in some series, are working out or in. And in those cases, of course, we create more trouble. So in essence, it's very much depending on the patient again. In a 16-year-old, I would not put in a ring because they are rubbing all the time, they have allergic diseases, all those stuff. In those cases, I would do the cross-linking only to stabilize it and wait for a year or 2 or 3 until it's stable and then put the ring in. However, if somebody comes in with 45 to get a treatment, in those cases where you have a strong cornea anyway, a naturally cross-linked cornea, and if you do have progression, in those cases I always would advocate for doing a combined procedure.
Okay. What about combining with excimer laser?
You know, that is a little bit difficult because removing tissue means that you're weakening that weak cornea even more. And also we know that you shouldn't, there are natural limits for removing tissue regarding success. So if you want to correct the cornea with a Kmax of 65 diopters, you will fail. But however, if that cornea has only 52 and you can correct 2 or 3 diopters in the area of the cone, that patient will be more than happy after all, see very well. So again, it's not a procedure that is good for everyone.
Theo, thank you very much for coming and talking to us today. Thank you all for joining us, and for more information on this and related topics, please visit us at eurotimes.org.